All right, so the last video I introduced the three main models, or the three main categories of theoretical models that are trying to explain family violence. This first video of those is going to begin with the discussion of some of the psychiatric models and their strengths and weaknesses. So I'm going to discuss two main categories of theories within the psychiatric model. There are more. This is not exhaustive. But I'm going to discuss two main categories of theories that fall under the psychiatric model. The first is the psychopathology theory, and the second is the substance abuse theory. So within the psychopathology theory, what those who agree with this theoretical model are attempting to say is that we can identify certain mental illnesses, certain personality disorders, and other psychological dysfunctions that can cause someone to engage in aggressive acts, violent acts, controlling acts towards their family, towards their intimate partners, towards their children, right? So basically what we're saying is, let's identify mental illness, personality disorders, psychological dysfunctions that create a risk factor here, or that could create an explanation that you became a violent, aggressive person because you have this psychopathology. Now, some pros and cons of this theory. One of the biggest cons is that despite how much research we have on this, researchers have failed to actually be able to isolate any specific disorder that would distinguish those who engage in family violence, right? Those who become violent and aggressive with their own family members from the rest of the population. In other words, there is no abuser disorder. When a link is found between an element of psychopathology and abuse, there are often many other explanatory elements that are also intertwined with that. There's substance abuse, there's adverse childhood experiences, there's some sort of environmental factors. And so then when we look at that at the big picture, that raises the question of, is the thing that led to the mental illness, to the psychopathology, so is the trauma that led to the psychopathology, the adversity, the stressors, whatever that led to the development of this disorder, also leading to the violence, right? So what we're saying is it wouldn't necessarily be the psychological dysfunction that's causing the violence. It'd be saying there's this other big picture thing happening over here that's causing both the disorder and the violence, right? So rather than looking at it as A causes B causes C, you'd be saying, no, A is causing both B and C. Hopefully I'm explaining that in a way that makes sense. And one of the quotes from your I about said from your textbook. I don't remember if this is from your textbook or from one of my other articles that I have bookmarked. I think it's from an external article now that I think about it. But one of the quotes that I found about this that I really loved is, a great deal of what is responsible for violence among people with mental illness may be the same factor that's responsible for violence among people without a mental illness. So what we're saying is, again, you have this other thing happening over here, this trauma, this adversity, this stressor. And it's saying that this group of explanations that could be intertwining with mental illness to create violence could also be creating violence among people that never have that intertwined with a mental illness. So again, it's going back to, what is that baseline explanation if we go deeper than the mental illness? Another con of this theory is that attempts to identify personality traits that can lead to domestic violence from the abuser's side have been inconsistent in the research and have been pretty difficult to apply in a meaningful way. There's also the issue that many individuals with mental illnesses never engage in aggressive behavior. And there's a concern among mental health professionals that we could be promoting a dangerous stereotype by trying to label this as this particular mental illness causes violence, that we can be stereotyping mental illness as inherently leading to aggression, when a lot of times that's never the case. There's also many individuals who engage in aggressive behaviors that are not mentally ill, right? You could give them whatever sort of metric, whatever sort of questionnaire, whatever sort of empirically established mental health assessment that you wanted to give them. You're not going to find anything interesting, right? So what we see here is an issue that it never works out in a streamlined and consistent manner. Lots of people with mental illness never become aggressive. Lots of aggressive people don't have mental illness. So it's not a 100% predictive theory, right? We can't say because you've been diagnosed with this thing, you're doomed, you're going to end up beating your partner one day, right? It doesn't work that way. It also doesn't work that way to say because this person committed violence against you, if we just get them to the right therapy and assessment center, we're going to be able to figure out their diagnosis. It's not a direct one-to-one relationship. Now, having said all of that, there are certain mental health symptoms that have been consistently correlated with violence in research. One of those is individuals who have what we call command hallucinations combined with persecutory delusions. If you've taken psychopathology, especially if you've taken it with me, those terms should be very familiar. But if not, I'll break them down a little bit. A command hallucination is the type of hallucination where you're hearing a voice that urges you to hurt other people. We sometimes see this with certain varieties on the schizophrenia spectrum. So they're actually hearing voices that they believe are telling them they need to cause this harm, they need to hurt this person. Going along with that is a delusion of persecution. A delusion of persecution is something that we will often see in variations of paranoid schizophrenia or sometimes in paranoid personality disorder. And this is where an individual truly, completely, genuinely begins to believe that someone's trying to harm them and someone's trying to kill them. So it becomes more of a fear response. In their mind, they're acting in self-defense, right? So an example of this would be somebody who truly becomes deluded to believe that their partner is a secret agent and has figured out that they have figured out the code that is being transmitted in the news, and now they're trying to kill them. That's an extreme example, but that would be the type of delusion you may see develop with certain types of schizophrenia disorders that can be an explanatory factor. That being said, that accounts for such a tiny fraction of family violence cases that we see. It's important to mention it because it is some research that supports that there's some credence to some of these psychopathology theories that certain problems can directly lead to violence. But again, this is not explaining the majority of your family violence cases by any means. A next category that has been linked is grandiosity or grandiose delusions, particularly when paired with mania, as what you see in the manic or the hypomanic phases of things that would fall on the bipolar disorder spectrum. So those delusions of grandiosity, basically they become convinced that they're not going to get caught. I have enough power that I can do this. I'm smart enough to pull this off. Things of that nature. We do know that some individuals, whenever they are in manic phases of a bipolar disorder, that can lead to increased aggression. And for some people, that aggression can be acted out. Again, this is not a one-to-one. This is not a direct relationship. Please do not think that I am saying that everyone who's diagnosed with bipolar disorder is dangerous and violent. Because again, the majority of times you don't see that. But for some individuals, and a lot of times substance abuse is a mitigating factor with this, some individuals with some forms of bipolar disorder can become violent during manic phases. And the last category of disorders that we have actually been able to verify with research is antisocial personality traits and borderline personality traits. Antisocial personality traits are the things that within the popular media we will often say is a psychopath or is a sociopath. Some of those traits of a lack of remorse, of not caring about the feelings of others, of having no regard for societal norms, we do have some direct correlations with those things and later family violence. And again, also borderline personality traits, there are some correlations between those and family violence as well. The second big category of theories that fall into the psychological model are the substance abuse theories. And I've already touched on this a little bit, that a lot of times, especially if you're talking about mania, it really kind of needs that extra element of substance abuse to see it cross that line. But the substance abuse theory is basically saying that drugs or alcohol either cause or contribute to family violence. And there are a few different categories and ideas behind these substance abuse theories that your textbook does a really great job of breaking down. But the biggest the biggest piece of this is that we're saying that drugs or alcohol impair your judgment and lessen your inhibitions. So if you have somebody who maybe already had problems with aggression, if it was their self-control that was preventing them from being a frustrated and pent up and aggressive person into actually like not acting that out, and then you add in a substance that's going to lessen those inhibitions and impair their judgment, that can contribute to that shift from someone who has an anger problem but has never been abusive to maybe somebody who actually does become an abuser. Now, one of the biggest concerns with this theory, one of the biggest cons that we see, and we'll talk about this when we get into some of the sociocultural models, is that this becomes an excuse, right? Because if we start saying this happened because they were drunk, the problem is then the alcohol. The alcohol has become an excuse. I wouldn't have done that if I hadn't been drinking. So we are reinforcing this idea that is already a problem in our culture, that the alcohol is an excuse. All I need to do is not drink anymore, and this is not a problem. Which, if you've ever known anybody who struggles with substance abuse, that is much easier said than done. And unfortunately, that is something that you do tend to hear from an addict multiple times before they actually do get help. Now, the pro of this is that we have established this link in research. Several studies have linked alcohol and drugs to violent behavior. That correlation is there. We have found it. We know there is some form of relationship happening here, but we have not fully disentangled the cause effect of this. Because again, like what we talked about with other mental illnesses, many addicts, many users never engage in violence towards their families. You can have somebody who has struggled with addiction from the time they were 16 to the time they were 45, and they've never physically laid a hand on anyone. So we know, again, it's not a direct relationship that this use causes violence. We know there's other mitigating factors going on, that there were already these risks here, there were already these factors here, and throwing some alcohol into the mix really did not help things at all. So again, it's seen as a theory of addition, right? That we know that it has some sort of explanatory power, but it can't be used on its own. And that really does encompass the psychiatric theory in a nutshell, right? They're good additive explanations, but they are not strong enough to stand on their own. So then the next video in this theory, we'll get into some of those social psychological theories and see what all can this add to our explanatory power with this.